I have a question that that's before us, but it's a little detailed, so I'm going to read it from the paper, and I want to get your thoughts on it. So the questioner, obviously a woman, she says, I have been having colored spotting discharge outside of my menstrual cycle. It is inconsistent and perhaps tied to my method of birth control, IUD. How do I determine whether I can perform ghusl and prayer if the spotting is for a few days in a row?
Yeah, I received this question a lot. And for those watching, IUD stands for intrauterine device. It's a form of birth control. So just for folks who don't know. So I think the question becomes around tracking our cycles. And so first of all, women are often taught, day one of bleeding is the first day that you track your cycle. And so what starts to happen is, let's say your period ends on day 4, as the question says, and then they're spotting on day 7. They're like, wait a second, like I just did ghusl. Is this my period? Do I have to do it again? So when women are tracking and they have irregular cycles, it becomes confusing. And there's also a lot of sensitivity around not wanting to pray too early or not wanting to pray in a way that is not in line with Shariah. So it would be great to hear your perspectives, because it's common, very, very common question by women.
Sure. This is one of those aspects where it's very easy, I think, to teach the subject, like when we studied it, but then in reality, there are all of these morphs and
Yeah.
things. So I'll try to do it justice. I think the rules around the menstruation are pretty simple. The shortest amount of a cycle can be 24 hours. So if a woman starts bleeding today, she will have to wait a minimum of 24 hours. If the bleeding ends within the 24 hours or at the 24-hour mark, and there's no bleeding after that, that can be considered a period. She can make ghusl and resume her, her devotional works. The maximum a period can be in the Sharia, and this is also important, is 15 days. Mm-hmm. So let's say a period goes consistently for 15 days, which I know it is very odd, it never happens, mm-hmm. but just for the theoretical point of view, and then 15 days plus 1 hour, they're still bleeding. The Sharia considers that bleeding after that 1 hour, after 15 days, to be not menstrual cycle, but to be blood that comes from elsewhere in the body and does not count as part of the menstrual cycle. So the woman makes ghusl, cleans herself and resumes her devotional life, her works, even if there's that post 15-day bleeding. The question is, what happens in the middle? Because that's sort of where I think, yes, in my experience, what really happens. So a woman's cycle is for 4 days, as you mentioned. She stops bleeding, okay, so then she should make ghusl and pray. But then 2 days later, she bleeds again. There's no sin because she thought she's finished, but because we're within the 15 days, that new bleeding will be tacked on to the original 4. So if we're still within the 15 days, then we'll consider there was just a gap. It's still a menstrual cycle. She'll stop praying and then wait until she's done. Everyone has to do their best. You mentioned tracking the period. I wanted to come back and ask you, because obviously this is not something I'm that familiar with. I'm assuming there are apps for this. Is it a hand calendar? What recommendations do you have for women who are tracking their period?
Great question. So most women will want an electronic form, and there are a lot of apps out there which also have great security features, because obviously this is sensitive data. So Apple has their own app where you don't share your data. There are other ones such as Flow Tracker, iPeriod, every sort of technological name out there. And I tell women, what's interesting, Tarek, is some women are tracking incorrectly, or they're not tracking. And then what happens is our menstrual cycles are indicative of our health beyond just reproduction. So for women to track, I would get an app. As soon as you start spotting or bleeding, you want to signify that and track the full cycle. And then you're able to kind of know when to perform ghusl as well with the 15 days, because if you're not tracking, you're going to lose track, obviously. And so it's important that women track their cycles, continuously, and then they'll see patterns. Because what we often say is, if you have irregular cycles, you'll need to see a doctor. So if one, month your cycle is 10 days, the other it's 5, you skip a couple of months, you'll want to see a doctor for that reason. So having the evidence there is data that you show the physician that you're having irregular cycles. So as you mentioned, I think apps are the easiest way to do it, and it's convenient, and it's most of the time secure. So I really recommend women do that. regardless of their marital status, as soon as you start menstruating within adolescence, I would say parents need to teach their daughters how to track their cycle.
So it sounds like this is an opportunity for a Muslim entrepreneur to develop a Muslim
Yes.
compliant app that tracks that with the fiqh behind it, which I think from the fiqh point of view is pretty straightforward. So if anyone's out there, that would be great. One thing you mentioned that I wanted to ask follow up on is, in my experience, now of course, obviously I'm not a woman, so I'm in my experience in helping women with this issue, I have found that most people's cycles is consistent, and that's why
Yes.
people that track their cycles, they have like an instinct, no, something is off, and that's when they start to ask. The questioner asked because of the the IUD, and I think that you mentioned the importance of seeking professional help, medical help, and that's true. Like sometimes I'll get a woman and there'll be just something very off, and
Yeah.
I know that it's off because I've never heard anything like that. It's just so weird that you continue to spot for 20-25 days or something like
Yeah.
that. Yeah, you need to go see a physician. Fiqh is not going to help you in that situation.
Mhm.
I mean, it helps you to know what you can and can't do, but you're going to need medical input to deal with the irregularity. So I second what you're saying about tracking the period. It's very important because there's a lot of manifestations that will happen down the line from tracking it.
Absolutely. And it's very empowering to track. Like knowing your body is really important. In addition to religious worship, it's very, very important to track your cycle.
All right, great. Thank you.